Welcome back to Memory Bootcamp Online with Dr. Gail Eskies and myself, Dr. Ryan Wilson. Welcome back to Memory Bootcamp Online with Dr. Gail Eskies and Dr. Ryan Wilson. Topic 2, Memory and Aging. For this topic, we're going to explore how memory and aging interact. We'll talk about how memory changes with aging, what factors can affect your memory. There is some good news about aging, and whether or not memory changes are normal or something that you may want to have investigated. Here is a graph of different kinds of memory. So the first thing you should know is that memory changes are common in healthy aging. The graph you're looking at right now shows how different processes change as we age. One of the things you might notice is that speed of processing, working memory, and long-term memory all do decline as we age, starting right from our 20s. What you could also notice, though, is that our knowledge is preserved and can actually increase as we age. So the things that we know about language and the world actually gets better. There are several factors that can affect memory, particularly as we get older. So first of all, normal age-related changes do occur in the brain. Medications can change brain function, stress, poor sleep, depression and anxiety, heart disease, high blood pressure, hypothyroidism, brain diseases and disorders such as dementia, Parkinson's. And interestingly, our own beliefs about aging can shape how well our memory functions. All of these factors can really interact with our memory at all three stages of memory: receiving, recording, and retrieving. You can imagine that if you haven't had a very good night's sleep, it might be harder for you to pay attention and focus your mind on the task at hand. Or when feeling particularly stressed, it might even be harder for you to just retrieve the material that you were thinking about. That's kind of like the tip of the tongue phenomenon. Also, we know that when under high levels of stress, which can include poor diet, anxiety, depression, and things like that our brain itself is exposed to high levels of cortisol, the stress hormone, which can, over extended periods of time, make it perform poorly. There is good news, though. Not all memories are affected by normal aging. Episodic memory, that's our memory for daily events, is most vulnerable, though, particularly for recent memories, whereas you can still maybe remember what happened on your 18th birthday. Semantic memory, that is our storehouse of facts and knowledge, remains strong or even gets better, just like we saw in the graph. Procedural memory for old skills, something like riding a bike, playing a piano, tend not to change, but it can get harder to create new ones. And even if you do get back on a bike, you might be a little bit rusty, but often those skills come back very quickly. One of the questions that we often encounter is whether or not my memory changes are normal. Dementia, things such as Alzheimer's disease or vascular dementia, create significant changes to memory and other thinking skills and problem solving that can cause major problems in daily function. Affected individuals are often unaware of their memory lapses, at least in the beginning, and it can be even more distressing once they recognize some of them. Often, it is significant others that notice first. So, what's the difference between normal memory changes and potentially abnormal memory changes? So here's a few examples. When it comes to names, forgetting the names of people you've just met is pretty common. I do it all the time. Forgetting the names of close family members or family friends, that would be unusual. How about having a conversation? Forgetting details of a conversation is common. Forgetting that you had a conversation, particularly when it's an important one and something meaningful for you, that can be a cause for further investigation. How about parking the car? Forgetting where you parked at a familiar grocery store, or in my case, when I used to park at the hospital, I wouldn't remember where I'd park and could often find myself one floor or two floors above or below because I was so used to parking there. I wouldn't remember what floor I parked on. Forgetting what your car looks like, that would be concerning. And the last example is around medications. Forgetting to take your medications once, not a big deal. Forgetting that you take medication might be more concerning. The other good news is that memory can be improved at any age. Memory, in reality, is a skill that can be cultivated, but it takes a lot of different things. You have to understand how memory works, learn some practical strategies, and it's not a one-size-fits-all. Some strategies fit better for some people. And last but not least, of course, there's no shortcuts. It is practice, practice, and then when you're sick and tired of it, it's more practice. So, Module 1, wrapping it all up, we have talked about the types of memory, which include episodic, semantic, and procedural. Do you remember the 3 R's to a good memory? It's receiving, recording, and retrieving. Are all forms of memory affected by aging? Episodic is most effective. Semantic gets better. Procedural holds. That's the end of Module 1. Hope you enjoyed this. Look forward to seeing you in Module 2.